Sharing hospital beds is the grim reality as India's COVID-19 crisis spirals out of control. An emergency oxygen supply is also now needed in a dozen states. More than 217,000 new coronavirus infections have been reported in just the last 24 hours.
2 to a bed. This has become a reality in hospitals across India as the country extends a record daily run of COVID-19 infections. Oxygen tanks and other essential supplies are running low, and corridors in medical facilities are overflowing with patients. Many have had to be turned away. In some areas, oxygen has had to be administered to patients on the street. There are also reports of dead bodies being left outside wards as mortuaries fill up. It's taken India just 6 days to log its latest 1 million cases of COVID-19. Fatalities are also on the rise. Nearly 1,200 deaths have been confirmed in the past 24 hours. That's the highest number in 7 months. But local media say that number could be much higher. The government has blamed people for not following COVID-19 protocols. But politicians themselves are pushing ahead with rallies for state elections. Senior leaders, including Prime Minister Narendra Modi, have been holding large gatherings of thousands of people.
From New Delhi, Ishan Garg joins us for more. Ishan, how is this emergency situation being handled by patients and authorities?
Well, patients are really distraught, and to be fair, a lot of those are not able to handle it very well. They're not able to cope with the shortage of beds, the shortage of oxygen, and also potentially life-saving drugs such as remdesivir. A lot of the people are taking online, on Twitter, on Facebook, and over WhatsApp messages and status updates asking people to help them out in this time of crisis. They're asking if plasma donations can be made, or blood donations can be made, or if anybody can put them in touch with hospitals but still have beds. And the situation is bad in urban centers, and experts say that we really have no idea how worse it could turn in rural areas where the healthcare infrastructure is already doing very poorly. Authorities are now trying to get the situation under control. The government of India is looking to import 50 metric tons of oxygen from countries that can supply it because there is a severe shortage of oxygen. And at the same time, we are seeing that vaccine supply are also on the low, and the government of India is trying to import them as well. But experts are saying that what's really needed at this moment is stricter restrictions on movements so that a lot of people are not able to congregate in tighter spots, because that's really the cause of the spread of the virus. And because of the new variants that have been discovered in India, they are feared to be super spreaders and also capable of reinfecting people. So that's the real worry for now.
Ishan, tell us more about the shortage of vaccines. India was a vaccine exporter.
Yes, and now it's looking to import as many vaccines as possible. Just days ago, authorities cleared emergency import of vaccines which have been approved by regulators in the United States, UK, EU, and Japan. Just today, Serum Institute of India's head, Mr. Radha Poonawalla, tweeted saying that America's ban on exports of raw material for the vaccine is causing a great delay in vaccine production in India. So we are seeing that from a country which had the capability to produce 2 billion shots, and it was believed that India will be able to vaccinate at least its entire population and still be able to export millions of doses worldwide. The situation has rather reversed. Now, the hope is that vaccines such as the ones produced by Pfizer, Moderna, they will be able to get emergency import licenses. But experts are warning that it may take several months until that situation is resolved. And they are saying that India needs at least 7 more vaccine candidates to be able to fulfill its target of vaccinating 300 million people by August. And that will only be 30% of its entire population of about 1.3 billion people. So more vaccines are needed, and more people need to turn up to get vaccinated where the vaccines are available.
All right, my thanks to getting us up to speed. Ishan Garg in New Delhi.